I'm Dr. Stream, a board-certified primary care sports medicine doctor. In this video, I'm going to show you a step-by-step, three-phase rehabilitation plan for plantar fasciitis, also called as plantar fasciopathy. My goal is to help you go from the painful first steps in the morning to all the way back to the activities that you love. So it's important to understand why we're doing this. The term plantar fasciitis is actually a misnomer. When we say fasciitis, it basically means that there is inflammation. And numerous studies have shown that this is not just pure acute inflammation, this is more of a chronic degenerative process, which means that the goal is to build the resilience of the plantar fascia. The goal is to strengthen the entire foot, improve the kinetic chain, and the rehabilitation is not just an option, it is one of the core treatment when it comes to the long-term treatment of plantar fasciopathy or plantar fasciitis. So with this in mind, it's important to understand that the recovery rate might differ for each individual. For example, one may take a few months to get better, for some it may take up to 6 months, for some it may take up to 1 year. The goal of the rehabilitation is to make sure that you're staying consistent, you want to make sure that you're getting stronger every week, and then you move on to the next phase when your body tells you it's ready. I've divided this rehabilitation plan into 3 phases. In phase 1, the goal is to minimize the pain, minimize the swelling, and able to weight bear without much discomfort. In phase 2, we will do a lot of weight bearing exercises to challenge the plantar fascia, and phase 3, we will do more advanced exercises, more single leg loading exercises to build the plantar fascia resilience. So without further ado, let's get started. So in phase 1, we'll be doing 10 exercises total. The first exercise is called as the seated plantar fascia row. So, and again, each exercise we'll be doing for 1 minute straight. For this exercise, I'm going to use a massage ball. You can either use a tennis ball or lacrosse ball or golf ball. So I'm going to place the ball on the floor and I'm going to apply firm pressure on the ball, and I'm going to roll the plantar fascia all the way from the heel to the toe. I would avoid putting direct firm pressure right onto the heel because that's where the pain and the inflammation is setting in. So I want to roll from just beneath that, just slightly away from that heel bone and then all the way to the toes. And my recommendation would be to do this for 1 minute straight. So by doing this, the goal is to help ease the tension in the plantar fascia and also help to improve the blood flow as well. So the next exercise is called as the seated plantar fascia stretch. For this exercise, you're going to cross the affected leg onto the other leg, and then I'm going to bring my ankle just slightly outwards like this. So this is inwards, I'm going to bring it outwards, and then I'm going to pull the big toe into dorsiflexion. So basically I'm pulling the big toe towards me, and then as I'm pulling the big toe, I'm actually also pulling my ankle towards me as well. And this way you will feel a gentle tension in the plantar fascia. So I'm going to hold the stretch for like 20 to 30 seconds and then relax, and again I hold for 20 to 30 seconds. One can consider holding for 1 minute straight, and it's totally up to you. But I recommend doing this plantar fascia stretch for a total of 1 minute. So again, pull the big toe in towards me, bring the ankle outwards like this, and then pull the ankle as well as you create that stretch in the plantar fascia just like that. Okay? So the next exercise is called as the seated gastroc stretch. For this exercise, I'm going to be seated on the floor just like this, and I'm going to use a towel or a stretch strap. So I'm going to loop the towel or the stretch strap on the ankle, and then I'm going to pull the ankle towards me. So I'm going to pull the ankle towards me, and I would feel a good stretch in my calf muscles here, primarily the gastroc muscles here. And I would hold the stretch for, you can do a full hold for 1 minute straight, or you can do a 20-second hold, take a 5-second break, and then again a 20-second hold and a 5-second break, and I would do this for 1 minute straight. So the next optional stretch, if you have time to add, would be called the seated Soleus stretch. For this, I'm going to use a foam roller to create a small knee bend. This will help to isolate the soleus muscle better. And then similarly, I'm going to put a strap on my ankle, and then I'm going to gently pull my ankle towards me as I feel the stretch in the calf muscle again here. But again, this is going to be more like an isolating the soleus muscle. And I'm going to hold both of these stretches for a total of 1 minute straight. As I said, you can do 20-second on, 5-second break, 20-second on, or you can do a total of 1 minute straight. So the next exercise is called as the toe yoga exercise. It's a great exercise to strengthen the small muscles of the foot. For this exercise, you're going to place the feet on the floor, and then I'm going to lift the big toe up as I keep the other 4 toes down, and then I would press the big toe down onto the floor as I lift the other 4 toes up. So I'm going to alternate this for a total of 1 minute straight. So I'm going to lift my big toe up, and then I'm going to lift my small toes as I drive the big toe down onto the floor. Again, similarly, lift your big toe up, and then I'm going to lift my small toes up. So one more repetition. So big toe up. So this looks pretty easy, but it is a pretty hard exercise to do. And this is a great exercise, as I said, to strengthen the small muscles of the foot. Okay, great. And I will do this for 1 minute straight. So the next exercise is called as the seated banded great toe flexion. And for this exercise, you need a resistance band. And I'm going to fold the resistance band, and I'm going to loop the resistance band onto the great toe. So remember, toe strength is so important for push-off, and in order to improve plantar fasciitis, it's important to improve the great toe flexion strength as well, or the push-off strength as well. So what we're going to do is that I'm holding a resistance band. My toe is pointing up. Now the goal is to push the toe down to the floor against the band's resistance, and that would count as 1 repetition. And I want to bring the toe up as slow and gently as possible. So again, I'm going to push it down, hold that for like 1-2 seconds, and then slowly bring it up. Again, push it down, hold for 1-2 seconds, and then slowly bring it up. Push for 1 to 2 seconds, and then slowly bring it up. So I would do this exercise for a total of 1 minute straight. So the next exercise is called the seated banded inversion. For this exercise, you need a resistance band as well. Again, this is a different type of resistance band, but you can use the previous exercise resistance band. You make sure that you create a loop and create a band like this. So I'm going to loop the band onto both my ankles, and then I'm going to cross my leg. So I'm going to cross this leg. So basically, this is going to be my affected leg. So I'm crossing the good leg on top, and then I'm pulling the leg a little bit to create tension on the band, and then the affected leg is I'm going to point my ankle inwards like this. So I'm going to bring my ankle inwards like this, and by doing so, I'm strengthening a key structure called as the posterior tibialis musculature, which is so important so that the ankle does not pronate as we walk and create undue stress on the plantar fascia. So it's important to strengthen the posterior tibialis musculature as well. And the goal is to do this exercise for a total of 1 minute straight, just like this. So next exercise is called as the seated short foot exercise, an excellent exercise to strengthen the intrinsic muscles of the foot. For this exercise, I'm going to be seated on a chair like this. And my goal of this exercise is to bring my toes closer to the heel. So one can do that by curling the toes, which is exactly what we don't want to do. So what we want to do is that we're going to press the toes onto the floor, and then I'm also going to press a slight pressure onto the from the heel as well towards the floor. As I do that, I'm heightening the arch here, and I'm going to hold that heightened arch for like 3 to 5 seconds and then relax. Again, drive the toes onto the floor, heighten the arch here, and hold that pressure for like 3 to 5 seconds, and then you can see relax. You can see how my arch is kind of collapsed right now. Not totally collapsed, but you can see it's collapsed. But then as I put the pressure, you can see that the arch tube kind of like gets a little bit more taller, and then I'm relaxing. Again, squeeze, the arch is heightened a little bit. I'm shortening the foot as well, holding that squeeze for like 3 to 5 seconds, and then relax. So I would do this exercise for a total of 1 minute straight. So next exercise is called as the seated calf raise exercise, and this is a very effective exercise to strengthen the calf muscles. And in phase 2, we'll be starting to do more of these type of exercise in a weight bearing manner. For this exercise in phase 1, we're going to just slowly bring the heels up, and then squeeze the calf muscle, hold for like 2 to 3 seconds, and then relax. Again, go all the way up, squeeze the muscle, hold for 2 to 3 seconds, and then relax. So I would do this exercise for a total of 1 minute straight. And the final exercise is called as the toe spreading exercise. So basically, I'm trying to make sure that I spread my toes apart as much as possible, hold for like 2 to 3 seconds, and then relax. So you can see here, my toe is not spread much apart right now. Now I'll focus on spreading my toes, and I'm going to hold this for like 2 to 3 seconds, and then come back. Again, spread my toes as much as possible, and then squeeze, do that for 2 to 3 seconds, and then relax. Again, one more time, spread the toes as much as possible for 2 to 3 seconds, and then relax. Okay? And I would do this exercise for a total of 1 minute straight. So I recommend doing this 10-minute routine every day, and once you start to feel your pain is better, then you're ready to move on to phase 2. So in phase 2, we'll be starting to add more load and then also do more stretches as well. The first stretch is a familiar stretch that we did in phase 1, is a seated plantar fascia stretch. Just a quick recap, we're going to lift the affected leg, cross that leg onto the neck, onto the other leg, and then I'm going to keep my ankle outward like this, and then I'm going to bring my ankle and my big toe towards me, and I'm going to hold this stretch for, either you can do for a total of 1 minute straight, or you can hold for 20 to 30 seconds. And I would do this stretch for a total of 1 minute straight. So the next exercise is called as the standing gastroc stretch. So for this, we're going to stand in front of a wall, like arms length apart, and then I'm going to bring my affected leg, I'm going to plant behind me, and my heel is going to be pressed onto the floor. So it's important to make sure that your heel is pressed onto the floor, it's not coming up, it's pressed onto the floor. Now, as I keep this position, I'm going to slowly lean my trunk towards the wall as I start to notice a gentle stretch in my calf muscles here. So the more I lean, the more the stretch I get. It's important to make sure that we keep our knees straight. So if you start to put a little bit more knee bend, then we are starting to isolate more of the soleus muscle. But for this exercise, I want to keep this knee straight, and I'm going to slowly lean onto the wall, and you want to make sure that the heel stays on the ground all the time during the exercise. And I'm going to hold this stretch for a total of 1 minute straight. You can consider doing for 30 seconds on, and then take a few seconds break and 30 seconds on, but the goal will be do at least for a total of 1 minute straight. Okay? So next exercise is called as the great toe banded flexion. And again, this is the same exercise that we did in phase 1. Just a quick recap. I'm going to loop the resistance band, I'm going to loop the resistance band onto the great toe, and I'm going to hold the tension, and then I'm going to push my great toe towards the floor against the band's resistance, and I will do this exercise for a total of 1 minute straight. So the next exercise is called as the standing short foot exercise, and it's the same exercise that we did in phase 1, except that we're going to do in a standing stance right now. So you can do this exercise on both feet simultaneously, but just for demonstration, I'm going to show you just one leg right now. So it's the same exercise, so except that we are standing right now, and now what I'm doing here is again same thing. I'm just putting, I'm pressing my toes onto the floor. I'm pressing my heel onto the floor as well. As I do that, I'm actually creating a more heightened arch here. I'm going to hold that squeeze for 3 to 5 seconds and then relax. Again, squeeze. I'm basically kind of like decreasing the distance between my toe and the heel as I heighten the arch. And the most important thing to make sure is that you don't curl your toes like this, but rather just keep the toes relaxed, but just put that pressure onto the floor as you create an heightened arch and then relax. Okay, so now I'm going to do this standing. So push the toes onto the floor, hold that squeeze, heighten the arch. You're basically kind of like shortening the foot and then relax. Again, do the same thing and then relax. Okay, so now we can do both at the same time. So standing on shoulder width apart, I'm going to press the toes onto the floor. As I do that, I'm just heightening the arch and then relax. So next exercise is called as the chair squat, and the goal is to progress from a chair squat to a completely regular squat. So in order for this exercise, you're going to start with the shoulder width apart, and you're going to imagine as though you're kind of going to sit on a chair like this, and then I'm going to sit on a chair and then I'm going to stand up. So I'm going to hinge at the hips. I'm not doing this. I'm just kind of like going back and hinging at my hips and then sitting and then standing up. So again, go all the way down slowly and then stand up. As you start to feel more comfortable, you can decrease the height of the chair. So I'll probably start from here. So where I would go all the way down, I'm going to sit on the chair and then I'm going to stand up. Again, sit on a chair and then stand up. As you start to feel getting stronger, then you can go all the way down and you touch and then come up. All the way down, touch and then come up. But as you start to become more and more stronger, then you don't need a chair. You can just do a regular squat. So kind of like go all the way down and then come back up. All the way down and then come back up. I would recommend doing this exercise on a barefoot so that you feel the foot, you feel the arch of the foot as you do this exercise. And I think this is most important when you're thinking about plantar fasciitis recovery. It's not just we're focusing on the hips and the glute muscles as well. We also want to focus on our foot muscles as well as we do this exercise. Again, one more time here, go all the way, squat, and then come back up. Okay, and I would do this exercise for a total of 1 minute straight. So the next exercise is called as the side lying hip abduction. For this exercise, I'm going to lay on my side. My leg is stacked on top of each other. I'm going to bring one leg up, and then I'm going to bring it forward, and I'm going to rotate the whole leg so that my ankle is pointing towards the floor, and then I'm going to bring my leg back. So either one can hold this position. You're isometrically contracting one of the key structures called as the gluteus medius, which is a hip abductor, and strengthening this muscle can help to eliminate undue stress on the plantar fascia. Or the other option is to you lower down and then come back up. So you lower down and then come back up. So if you find that this is easier, then you can loop a resistance band just like this and then do the same thing. So I'm bringing the leg forward and then rotating it and then bringing it back. And either I can hold this position for a total of 30 seconds to 1 minute straight, or I can bring it all the way down and then come back up. So this is going to create an extra challenge for the hip abductor muscles. But let us say if you're really strong, then you can do like a side plank. So I can do a side plank like this, and then I'm going to bring my leg forward, bring it back, and then I'm going to do this, and that's going to be more challenging for the hip abductor muscles. And make sure that you also do on the other leg as well. And I would recommend doing this hold or doing the lowering type of an exercise for a total of 1 minute straight. So basically it'll take 2 minutes to complete this whole entire set. So the next exercise is called as the double leg calf raise. For this exercise, you can just stand on a floor just like this, and then I'm going to go up on the balls of my feet, my heels are up, and I'm going to hold this for like 2 to 3 seconds and then come back. Again, balls of the feet, hold for 2 to 3 seconds and then relax. But this is more like a general exercise for calf raise or calf muscles. But in order to make it more specific plantar fasciitis, it would be good to create some sort of a toe extension. So basically, this is a norm. This is like I'm placing my foot on the floor like this. But if I create a slight toe extension just like this, that'll increase the tension on the plantar fascia and thereby make this exercise more specific and effective for plantar fasciitis. For this, you can grab a towel and fold it just like this. And I'm going to place my toes on the top of the towel. So now instead of my toes like this, my toe is slightly like this and creating a tension on the plantar fascia. And now I'm going to do the same thing. I'm going to go all the way up, hold that contraction for like 3 to 5 seconds and then relax. Again, all the way up, hold that contraction for 3 to 5 seconds and then relax. So I would do this exercise for a total of 1 minute straight. And let's say you're getting stronger, then you can find a stepper like this. And I'm going to place my towel onto the stepper. You can also do that on a stairs as well. And now, again, same thing. I'm going to place my toes on the towel. And now, as I go down, I'm also creating a good amount of stretch on my calf muscles, and then go up all the way up, squeeze that contraction for 3 to 5 seconds, and then come back down slowly. Again, go up, squeeze that contraction for 3 to 5 seconds, and then relax. You can use your hand on the wall to have a little bit more of a balance, but otherwise don't lean onto the wall. Again, come back all the way up, hold that contraction for 3 to 5 seconds, and then relax. So it might take around 9 to 10 minutes to complete this entire circuit, and I would recommend repeating this circuit again for one more time to get a good effective workout. And I would recommend doing this 3 to 4 times a week. Once you feel like you're getting stronger and these exercises are getting easier, then I would recommend moving on to phase 3. So in phase 3, we'll be doing more advanced exercises and single leg loading exercises. The first exercise is the similar exercise that we've done in phase 1 and phase 2, which is basically a seated plantar fascia stretch. Just a quick recap. You're going to cross your legs. You're going to pull the toes and the ankle towards you. You're making sure the ankle is kind of like a little bit more outward rather than inward. So you're keeping it outward, and I'm going to pull the toes and then ankle towards me, and I'm going to hold this stretch for a total of 1 minute straight. So next exercise is again a similar exercise that we did in phase 2, basically a standing gastroc stretch. Just a quick recap. Shoulder width apart, lean onto the wall. I'm going to place the affected leg behind, the heels on the floor, and then I'm going to slowly lean my whole trunk onto the wall as I would feel a gentle stretch in my calf muscles here. And I'm going to hold this stretch for anywhere between like 30 seconds to 1 minute. You can do a 30-second hold, then take a break and then do a 30-second hold, or you can do a total of 1 minute hold. So next exercise is called as the standing short foot staggered lunge. This is a great exercise because we're going to combine two movements. We're going to combine the short foot exercise as well as the lunge exercise in order to create a great challenge for balance, challenging the plantar fascia and challenging the midfoot as well. For this, you're going to stand on a staggered stance just like this, so almost kind of like a lunge position. But before we do the lunge, I want you to activate the short step. So again, what we're going to do here, we're going to drive that toes onto the floor, drive the heel onto the floor, and then I'm going to heighten the arch here. So basically, I'm heightening the arch here, okay? And now, as I keep that heightened arch, then I'm going to slowly go into a lunge, and then come back up, and then relax, okay? Again, one more time, do a short step. So basically kind of like heighten the arch here. So now it's all heightened, and then I'm going to do a lunge, slow lunge, and then come back up, okay? And then relax. Again, one more time, shorten that step, shorten the foot. So basically drive the toes onto the floor, arch high, and then going on to the lunge, and then come back up. So you want to make sure that you keep that heightened arch during the lunge movement, and then come back up, then relax, and then reactivate. So I would do this exercise for a total of 1 minute straight on each leg. So basically 2 minutes total to complete the entire set. So next exercise is called as the monster walk. For this exercise, you need a resistance band. And I'm going to loop the resistance band around my knee first. And then I'm going to stand on a shoulder width apart. And I'm going to create a slight bend in my knees. And I'm going to create a slight bend in my hips as well. So now I'm going to step away this way. So 1, 2, 3, 4, 5. And I'm going to step this way again. So again, we are targeting an important muscle called as the gluteus medius here. And then I'm going to walk in a staggered stance forwards like this, 4, 5, and then backwards, 1, 2, 3, 4, 5. So I'm going to do that. Again, walk sideways, walk this way, walk forward, walk backwards. I'll try to do this for a total of 2 minutes straight. But let's say if this one is becoming easier, you can either choose a heavier resistance band, or what I recommend would be to loop the resistance band around the ankles, and that's going to create a little bit more extra challenge. So again, same thing, we're going to step towards this way, so 3, 4, 5, and then step this way, 1, 2, 3, 4, 5, and then I'm going to walk forwards, 1, 2, 3, 4, 5, and then we're going to walk backwards, 1, 2, 3, 4, 5. Okay, again, same thing, you'll do this for a total of 2 minutes straight. Again, you're strengthening the hip abductor muscles here. So the last exercise is called as the single leg calf raise. So we did double leg calf raise in phase 2. We're going to do a single leg calf raise in phase 3. So again, like in phase 2, we're going to use the towel to create a slight toe extension so that we create a little bit of stretch on the plantar fascia, tension on the plantar fascia before we do this calf exercise, so that this could be more effective for plantar fasciitis or fasciopathy. So again, I'm going to, let me use this one. So I'm going to place my toes on the towel, so create a gentle toe extension. So I'm going to bring one leg up. I'm going to use my hand for balance here. I'm going to squeeze all the way up, go all the way up, then squeeze for 2 to 3 seconds and then relax. Again, all the way up, squeeze for 2 to 3 seconds and then relax. Again, you're going to go up, squeeze for 2 to 3 seconds, and make sure they don't come down fast, and make sure that you have a slow, controlled movement. Again, go up, hold the contraction for 2 to 3 seconds, and then slow, relaxed, slow, controlled movement all the way back to the floor. And once you feel like this exercise is getting easier, then you can go on to a stepper or a stairs. I'm going to place the towel onto on the stepper here. Again, same thing, placing my toes on the towel, creating a slight gentle toe extension here, stretch on the plantar fascia. I'm going to go all the way up, squeeze, hold the contraction for 2 to 3 seconds, and then come back down slowly. Again, go up, hold the contraction for 2 to 3 seconds, and then come back down slowly. Again, one more time, go all the way up, hold the contraction for 2 to 3 seconds, and then come back down slowly. Okay, so I would do 1 minute for each leg, so total 2 minutes for this whole exercise. So this whole routine may take anywhere between 8 to 10 minutes to complete, and I recommend repeating twice to get a full effective workout, and I recommend repeating this workout 3 to 4 times a week. So remember, recovering from plantar fasciitis is a journey. There might be some good days, there might be some bad days. There are some weeks that you will progress well. There are some weeks that you might have to downgrade to a lower phase. For example, you might be doing a phase 2 exercise, but then for a few weeks you might have to downgrade to phase 2 before you move on to phase 3, and that's totally fine. The goal is to make sure that, remember, the rehabilitation is never a straight line. It's going to have ups and downs, but you want to make sure that you continuously progress, build the resilience of the plantar fascia, the supporting muscles, and thereby you get this plantar fasciitis long-term completely better. Okay, I hope this video was helpful. I would really appreciate if you could post an appreciated comments if you found this video helpful. And if you have any questions or comments, please post in the comment box below, and I'll see you in the next video. Until then, goodbye.